Yes, so what we found that on other aspect, we also found that the target protein HER2 gene expression and then protein expression is downregulated. So from this one, we also supported the current clinical trials testing BREAST-04 study, which is conducting the T-DXd in low HER2 population. So from our data also supporting that low HER2 population can benefit from the T-DXd treatment. That is what we found. However, from the genetic the changes, if patients have a high the DNA repair pathway gene elevation, this patient needs to be considered combination therapy, which will be the DNA repair pathway related target.